I'll be very brief because we want to leave some time for discussion around, specifically around the post-2015 development agenda. Let me start just by saying a couple of things about the report of the high-level panel of eminent persons. This will be something that will be discussed in a little more detail as part of the proposed statement that Julian will be talking about. I just wanted to say a couple of things. The report is a broad statement of principles. There are some examples of priorities, but these examples that have been included specifically don't exclude other things that might be part of the post-2015 development agenda. There's still a lot of work left to be done on fully developing the post-2015, the post-MDGs framework, and there are still plenty of opportunities to think about how mental health will be part of the new development landscape. And I think that's the first point that we need to make. It's not closed off. All of the decisions haven't been made. A lot of work has been done, but there is still a lot of room for thinking about what will be the role of mental health, what will be the place of mental health in the new development landscape. And I think the concept, what we need to do in terms of thinking of how do we think about mental health as part of this new development landscape, I think the most appropriate conceptual framework for us to be working with is this concept of human security, which has been developing over the past 15 or more years as part of the UN's work on thinking about development. In 2003, the Commission on Human Security, which was chaired by Sadako Ogata, who was the former High Commissioner for Refugees, and Amartya Sen, who many people know, who was Nobel laureate in economics and probably one of the most influential writers on development, chaired this commission, and this was the report that was published in 2003. The UN General Assembly made this resolution: we stress the right of people to live in freedom and dignity, free from poverty and despair. We recognise that all individuals, in particular vulnerable people, are entitled to freedom from fear and freedom from want, with an equal opportunity to enjoy all their rights and fully develop their human potential. This kind of statement, I think, encapsulates much of what we're trying to do in mental health. And I think we need to reorient our thinking to this kind of human security way of this human security sort of notion that is now, I think, so powerful within the UN institutions. The former UN Secretary General had this to say about human security. He said, human security in its broadest sense embraces far more than the absence of violent conflict. It encompasses human rights, good governance, access to education and health care, and ensuring that each individual has opportunities and choices to fulfil his or her own potential. Every step in this direction is also a step towards reducing poverty, achieving economic growth, and preventing conflict. Freedom from want, freedom from fear, and the freedom of future generations to inherit a healthy natural environment, these are the interrelated building blocks of human and therefore national security. And as you read through the report of the Eminent Persons panel, I think these kinds of ideas come through in pretty much everything that's said as part of the thinking about the post-2015 agenda. The definition of human security given by the Commission is to protect the vital core of all human lives in ways that enhance human freedoms and human fulfillment. The responsibility to protect fundamental freedoms, to protect people from severe and pervasive threats, build on people's strengths and aspirations, create political, social, environmental, economic and cultural systems that protect human survival, livelihood and dignity. You can read into this the kind of change which is happening in our thinking about mental health. If you map the recovery movement on these kinds of ideas, I think the mapping is pretty close in terms of how we think in a rather new way about mental health. It's fully consistent with new ways of thinking about mental health and the development of mental health services broadly defined, including all of the things that are required in order to deal with issues of disability, poverty, disenfranchisement, marginalisation, and so on. So strengthening human security requires protection, so what's sometimes referred to as protection from above. So we talk a lot about the need for mental health law, we talk about the need for human rights protections and so on. We talk about the need for provision of various kinds of services, with, for instance, social security arrangements. We're talking about universal coverage. This is a kind of protection from above in a number of ways. And just as important are the empowerment strategies. So people are able to advocate on their own behalf and are able to make decisions on their own behalf. Again, these are issues that are very much at the heart of what we're talking about now in terms of how we should think about the design, development, rollout of mental health services broadly defined. In my view, the most important legal instrument that we now have is the Convention on Rights of People with Disabilities. This is, we can talk about the presence or absence of a Mental Health Act. I think that the CRPD is probably a more important instrument than mental health law, and ensuring the implementation, the full implementation of CRPD is probably the most direct avenue for ensuring those kinds of protections and empowerment that are required in order to create the kinds of mental health services that we would want to see. Development agencies have been, development agencies used to think, including UNDP, that if you ensure economic growth, that's going to do everything that needs to be done. And I think the human security construct comes out of the dissatisfaction with this view, because clearly, even though you can improve, you can get substantial economic growth, there are vulnerable groups that are always marginalised, left behind, not included in the new prosperity, and so on. So development agencies have rather slowly, but now I think fairly completely recognised that if their development efforts are going to be effective, that they have to focus on vulnerable communities, vulnerable groups that are marginalised and that are not actually getting benefit of the broader development activities that are going on. And there is a new focus on ensuring that vulnerable groups receive particular attention and assistance. Disability inclusive development is now a widely accepted way of thinking about development. Australia just last month appointed a disability ambassador in order to actually, push much harder around these issues of disability in international fora. So we know that the vulnerable will not necessarily benefit from broad development assistance unless specific things are done to ensure that they are included. And I think these are the kinds of recognitions that create the opportunity for us to be saying what we need to say about mental health and its part in contributing to the broader development agenda, which is mostly about reducing poverty and the other kind of normal development goals. So a major issue for us is how will mental health be part of this new development landscape, and that's something that Julian will be talking about in a couple of minutes. The report from the Eminent Persons panel identifies 5 big transformative shifts, is the way that they describe them. Leave no one behind, put sustainable development at the core, transform economies for jobs, build peace and effective, open and accountable institutions, and forge new global partnerships. We can think about how attention to mental health will contribute to each of these big transformative shifts. And I think the framework was developed by Sen really quite some time ago. And it's the framework that I think is informing the new development agenda. It's certainly informing the human security construction that I think we need to be working with. And this is a kind of a simple representation of it. We need to focus on what are the enabling conditions that we have to create in order to ensure a certain set of basic and absolutely essential freedoms to enhance the capabilities of people to live lives that they consider worth living. This is the kind of structure that I think we need to be working with when we're thinking about mental health and when we're thinking about mental health services. And I would suggest that this is the kind of argument that we need to make for why mental health is essential in the new development landscape. That's it from me.